Even as the trend continues with more and more states legalizing marijuana in America, that wasn't enough to convince CBS to allow the running of a commercial during the Super Bowl about medical marijuana.
Medical cannabis saved Austin's life.
Cannabis has given me my life back.
There are families in other states having to watch their children die.
Medical marijuana is not legal at the federal level, but cannabis grower Acreage Holdings said it wanted to show how marijuana helps people cope with pain. CBS said its broadcast standards don't allow it to accept cannabis-related advertising. Here's what the company had to say to us.
Obviously, we were incredibly disappointed, although it wasn't wholly unexpected. We really view this as an opportunity to get out a message of advocacy in the area of medical cannabis accessibility, and understand that the very reason that the ad was rejected by CBS is the exact same issue that's causing millions of Americans not have equal and fair access to medical cannabis.
All right, let's bring in our A-plus panel for tonight's show. We are joined by Republican strategist Jeanette Hoffman and Democratic strategist Bill Caruso. Start with you, Bill. You've done your share of lobbying on behalf of the cannabis industry.
Advocating, Bill, advocating.
Advocate, is that what we call it now?
Yeah.
The L word we don't use. On a serious note, the company seems to be very upset about this, but they're making some bold statements saying that it's proven. Everybody knows it. There's only one side. Is that a fair thing for them to say?
It is and it isn't. Here's the problem. They are right, and there's the issue why CBS isn't going to run this ad, because it is against federal law, and we don't have a lot of profound research going on in our country, and some of the best research areas in our country. But it's not to say there isn't research going on in Israel and other countries. There's profound research in Canada, our northern border. Ask a patient, ask the mother in that ad whether this is working, and you'll find it is. And that's why I think you see this court of public opinion changing.
This is a very brilliant PR tactic by the company. They know that CBS can't run this ad because it is illegal at the federal level. So what they're doing is they're getting the rejection and they're using it as a story to run the ad in the news media and tell the story.
So did they just save themselves, what, $1.5 million? What is it? What does it cost? A couple $1 million?
$5 million.
So $5 million bucks. They're getting all this publicity for free. We're watching the ad.
They are, and it's a great message. And listen, I think the more people that see and can experience, and this is how most things change in our culture, people have real connections to these patients, to family member. You're seeing this change from an anecdotal level. This ad helps that because you see the impact on real people.
But it's too soon. It's too soon to say if this is proven. It's not been evaluated by the FDA.
Very emotional, this ad. You see a sick kid. You can't help but it pulls at your heartstrings. Is it, though, somewhat insulting to an adult population that we are not talking to a doctor that comes up and says, look, here are the numbers?
And that is the power of advertising, Bill. It's emotional, it pulls at your heartstrings, and it's accomplishing its goal.
Policy can't be dictated on emotion, though.
It can't be, but here's the deal. We need to deschedule this at the federal level. I think most adults understand from a medical standpoint, we need to break down this wall and allow the research, allow doctors to get engaged more on this. That's what's broken in the medical system right now, and I think that's starting to change at the federal level.
So where are the Democrats? New Jersey has 11 out of 12 Congress members are Democrats and 2 U.S. senators. Is Booker Menendez too distracted with what, something else?
No, they're on it. And here's the great news. It's both sides of the aisle. They can't agree that today is Thursday down there in Washington right now, but you can, on a bipartisan level, agree on this. And the president is even agreeing on some of these things.
I don't think anything's happening with this with the federal government shut down right now.
All right. Thanks, guys.